have heard already from one of the largest private hospitals and from a public policy perspective. Now let's hear from one of the largest public hospitals. I'd like to welcome Dr. Ajai Singh, Executive Director of AIIMS Bhopal, to have his.
Thank you very much. First of all, I would like to thank the organizer for inviting me and giving me this opportunity to speak and to share some of the innovative ideas which we have implemented, in the technology has been implemented in the medical education as well as the other aspect of the health. So, for me, the concept of Viksit Bharat is not just a medical treatment, something which we have to do. It is, I feel, everybody knows that India is having so much diversity, and unless until, irrespective of different factors such as the language, reason, religion, beliefs, food habits, languages, and many others. Every technology, every good policy must reach each and every person, and every person at, if possible, nearest place to the where the person are living. So only then the concept of the Viksit Bharat will be fulfilled. And as we all knows that in 2004, the central government has initiated making new AIIMS on the terms of AIIMS Delhi, with the concept that a new AIIMS should be made so that the regional imbalance as far as the healthcare is concerned would be over. And in 2012, AIIMS Bhopal was established along with other 6 AIIMS, and we are catering a large population of central India. So for us, from the AIIMS Bhopal perspective, we have divided the roadmap of Viksit Bharat as far as the healthcare is concerned into 4 subsections, and I will enumerate few of the steps, innovative steps which we have taken in each step, each subsection. The first foremost is medical education. So medical education is very important. I am keeping it before patient care. So we are meant for the medical education. We have used many innovative ideas to improve the quality of the medical education. We are having e-classes in which we are covering many such medical colleges across the state and neighboring states such as Uttar Pradesh, in which due to some reasons the medical teachers are not so many, so it is affecting the medical education, and we are providing the e-lectures, live interactive e-lectures from our smart classrooms to to many of the medical colleges of Madhya Pradesh and Uttar Pradesh. Along with this, we have kept more than 150 lecture repository in our website. Anybody can, any student, if they have missed the lecture, can go and take out and see the lecture, what happened in that lecture. We are having e-library, and that is very we are proud of, because now our students, even the UG student, nursing student, paramedic students are they can look into the latest thing through digital. They need not to go to the library, but from their hostel and their rooms they can approach that. We have established an app. AIIMS is catering students from various states, and sometimes the language is a problem. And majority of time, though Madhya Pradesh has taken the initiative of introducing the Hindi into the medical education, but still we are the primary language in which medical education is being done is English. But still, there are many families, many students who are not so good in the English, and they are not able to understand and perform good. So we have developed a app through which that can be translated, the lectures can be translated into their local languages. I think it needs more work, but still we have this concept and we have working on that. We have a full-fledged simulation and emulation lab, so that our student, training doctors, nurses can go and they can be trained without not on the patient but on simulators. We have working on the same way as we are working for UG and PG students, we are working for nurses and paramedics equally, because as ma'am has said that they are the backbone, very important, we should not forget their contribution. Now I would come to the patient care, number two. We are having a very unique concept, that is tele ICU. We have AIIMS has been connected with the district hospital of Vidisha, which is around 150 kilometer away from the Bhopal, and Satna, which is around 300 kilometer away from the Bhopal, AIIMS Bhopal. And we have two-way communication in such a manner that ICU patient can be seen and can be given the consultation by the consultants of the experts of the AIIMS Bhopal without going there or without needing any patient to be transferred to our side, and they are getting the best experts' opinion as far as the ICU is concerned. We have doctor to doctor and doctor to patient teleconsultation, and very happy to share that around 80 PSC has been attached to the to AIIMS Bhopal. We have AI based SOPs, though personally it is very initial phase of the AI. I think we should work more, but still we are incorporating, and in curriculum also we have kept some of the lectures as far as the AI is concerned. We have online registration through the app, so that the biggest challenge is the long queue, waiting time for the patient to go for the OPD. So there is no queue. Anybody is welcome to visit us. They will see there is no queue, and we are having 6,000 plus patients per day in our OPD, but no queue. We have online payment system. We have paperless system. E-hospital we have adopted, and now the patients are getting their reports, their MRI, CT, X-rays, and the lab reports on through their WhatsApp. They are getting these things at their home without visiting again and again to our hospital. We have started drone services to cover the tribal areas of central India, have started the robotic surgery, and Make in India MRI and CT as a principle we are adopting, and we have started the exchange program of the faculty as well as with the students as far this IIT and IIM is concerned. We are doing various research, including the environmental effect on the medical health and interactive with the Ayush pathy. We are doing the research in the chronic diseases and the tribal health, and also prevention and early diagnosis through the outreach, through the technology we are doing. But we have initiated one state, one health, one emergency policy in Madhya Pradesh, and we have made a uniform policy so that can be adopted by each and every hospital at the periphery and can get the quality treatment. But for me, any technology is good if it is not costing extra to the patient. So we have to be little bit cautious that we have a big population which needs free treatment, and that is the mandate of our government. So technology is welcome only if it is not costing any extra cost. With this, I would like to thank again. Thank you very much.
Thank you, sir, again for touching some important aspects. When you're talking about innovations done by AIIMS Bhopal, the focus on medical education, yes, that's ultimately where the backbone and the future, the entire plank on which healthcare will stand is being created. Then you are talking about very innovations like the tele-ICU, and finally involving the other important aspect is you have to look at the budgetary constraints also, because ultimately it's people from all socioeconomic strata who are coming into the healthcare system, and we need to be affordable to all. Thanks.